Okay, so the first thing I'm gonna do is I'm gonna make sure that I have all my equipment. So I have my needles, my syringe, the medicine, and my gloves, and then I'm gonna make sure that the patient doesn't have any allergies. Then I'm gonna wash my hands and I'm gonna prep the medicine. So I'm just gonna like wipe the top of the vial. And then I'm gonna identify the patient. So their name is Paul Bavaro. And then I'm gonna ask them to verify the spelling of their name and their date of birth for me. And while I put my gloves on, I'm gonna just explain to the patient the procedure and why we're doing the injection. And then I am gonna pick an injection site on the patient, make sure that I have the right one, or the right injection site. And then I'm gonna make sure that the patient is like sitting or in the right position and that the drape is covering them like wherever it needs to be. And then I'm gonna wipe the site with one of the little wipes, and then I'm gonna allow it to dry. So, while it's drying, I'm gonna grab my syringe and then the pink needle, and then I'm gonna uncap it, and I'm gonna grab the vial, and then I'm gonna fill it to about like, like a little bit over 1 milliliter. Actually, I'm gonna do 1 milliliter. Oh. Okay. And then I'm gonna recap it. Grab the new cap, or the new needle, uncap it, and then I'm gonna like grab some of the surrounding skin so it makes it easier. And then I'm gonna go in at like this angle, and then I'm gonna slowly inject it. And then withdraw, and then I'm gonna put a gauze on the skin. I'm not gonna like wipe it or anything, just make sure that I'm applying pressure. And then I'm gonna have the patient hold the gauze to apply the pressure. And then we don't recap the needle, but I'm gonna make sure to discard the needle and the caps in the right bins. And then I'm gonna put the patient back in like a comfortable position. And while I take my gloves off, I'm just gonna make sure that the patient is responding, or that their skin is like responding in the right way. They're not feeling any negative side effects. And then I'm gonna also document the time, the date, and like where the injection was. Do all that documentation and like keep checking on the patient, making sure that they're not having any bad reactions to the injection.